It's early morning and the start of shift for specialist paramedic Tim and occupational therapist Jessie. They work as part of the Falls and Frailty response team, funded by the Better Care Fund through a partnership of health and social care organisations across Berkshire West. The team combines an occupational therapist to carry out an on-scene assessment with the clinical skills of a specialist paramedic, meaning they can close wounds or assess and treat minor illnesses without the need for a hospital admission. Rather than dispatching an ambulance, the team use a specially equipped van.
Obviously most ambulances haven't got walk-in frames, commodes, bed frames, etc. But as we come across cases and Jessie feels the patient may benefit from that, we've got the kit immediately to give.
And it's not long before Jessie and Tim are on the move. Falls and falls prevention has become an important healthcare intervention. On average, 30% of people over the age of 65 will fall at least once a year, and this increases to 50% in people aged over 80.
Falls referrals up until now have always gone from the ambulance service to another part of the NHS, and then somebody's gone out later on to see those patients. So we've dealt with the immediate part of the problem, they then come and deal with the other part. That can leave a gap in time. And it can also mean that some patients are taken to hospital when they don't need to go, because they could be seen at home, everything put into place, all the aftercare and all the assessments that they needed at one go.
The paramedic kind of starts off the process and makes sure that there's no obvious medical concern before we then kind of move on to we can get you up off the floor if you're on the floor, or kind of where we need to go from there. But we do very much talk with each other, we very much kind of problem solve if there's something that's between the two remits.
On the other side of Reading, Tim and Jessie have just seen their first patient of the day.
We've been able to do a functional assessment, gather some information as to what's going on from a social perspective and what our functional baseline was. We were then able to get our gentleman up off the floor using our Manget ALK, and then progress on to establishing what the concerns were in relation to the fall. For this particular scenario, we were able to raise the equipment further up because it was too low down, which was increasing his risk of falls. And then we were able to liaise with social services about perhaps a potential care package.
In 2019, the service attended 567 patients. Of those, 72%, or 408 people, were able to remain at home following interventions from the specialist paramedic and occupational therapist. 10% above the average for this cohort of users. This project is an excellent example of the NHS strategy. Right care, right place, right time. The majority of referrals to the service come from 999 calls. This means that suitable patients receive the most appropriate service for them, while also ensuring vital emergency ambulances can be used more effectively, all of which means the number of people this innovative Frailty and Falls project will help is set to rise and rise.